Leslie, do you want to come in and talk about our events and our CPD programme?
Yeah, I will do. Thanks, Lindsay. So I'm Leslie Allen. Apologise if I'm in a shared office today, so if there's some background noise whilst I'm talking, that'll be why. So I'm co-chair of Health Libraries Group with Lindsay. And in my day job, I work as library manager at Birmingham Community Healthcare. So the other things that we get involved with are things that maybe you're more familiar with. So we have our own conference every couple of years. So some of you may have attended our conference in June at the Royal College of Physicians in London, which was very successful, and our first conference since before the pandemic. And in very exciting news that you may or may not be aware of, we are sort of chief coordinator, if you like, for the 2026 International Congress of Medical Librarianship. That'll be taking place in Glasgow in 2026 in July. So we're very excited about that, and we'll be working with lots of partners on putting the programme together and that kind of thing. So look out for more information on that as time progresses, and there'll be opportunity, obviously, for you to submit abstracts and things like that. We also have a very active CPD panel, of which, as Paul said, he's co-chair with Hong An, and Bali, our speaker, she's a member of the CPD panel. Very active group who help organise all of our events in terms of CPD activities, always looking for new enthusiastic people to come and help along with that. Really great for your personal development. Bali's currently working on a chartership, I'm sure she won't mind me saying, and obviously this is great evidence for her in terms of her chartership application. In terms of the committee, if you want to get involved in any way, please get in touch with Lindsay or myself, and we'll tell you what you need to know, and we'd be make you very welcome. We'd be pleased to see you.
Thank you so much, Lindsay and Leslie, for giving us an intro to HLG. Hopefully this gives you a taste of what you can expect from the HLG CPD offer. But yes, without further ado, I'd like to invite Bali Moore. So she is Senior Library Technician at the Royal Wolverhampton NHS Trust, and she, as already mentioned, she is a member of our CPD panel and contributes to shaping our CPD offer for all of our members across like the health and social care library sector, and yeah, really looking forward to hearing about all the work that she's been doing on RCTs in her trust. So over to you.
Thank you very much. Thank you. Yes, it's an exciting time of year. It's that time where we can start promoting randomised coffee trials. So I'm Bali, I'm the Senior Library Technician for Walsall Healthcare NHS Trust. A randomised coffee trial is an initiative designed to foster connections and improve networking within an organisation. For those who are familiar with randomised coffee trials, you will understand it's a medical terminology play on words. It's commonly known by clinicians as randomised control trial, whereby it's a study in which a number of similar people are randomly assigned to two or more groups to test a specific drug, treatment, or other intervention. One of the group, the experimental group, has the intervention being tested. The other, the comparison group, has an alternative intervention, a dummy intervention or a placebo, or no intervention at all. The groups are then followed up to see how effective the experimental intervention was. Outcomes are measured, and any difference in the response between the groups are assessed. This method helps minimize bias, allowing researchers to establish relationship between the intervention observed and the outcomes. With this in mind, to support librarians to adapt this method, one of the knowledge management tools in health libraries is to introduce a randomised coffee trial within their organisation. Our role as knowledge specialists is essential in creating a healthcare environment that values evidence-based practice, continuous learning, and innovation. We can achieve this by connecting people, knowledge, and best practice This contributes significantly to the improvement of healthcare delivery and their outcomes. Next slide, please. For the last 5 years, or since 2019, Walsall Healthcare Library Service have hosted annual networking events each November, originally called Randomised Coffee Trials. These events have been rebranded as Getting to Know You this November, Meet New People, Make New Connections. Name changes were required to address the misconception that RCTs were exclusively for clinical staff. The initiative supports the library team's efforts to promote knowledge management, showcasing various ways for staff at both Walsall and Wolverhampton Healthcare NHS Trust to share evidence and knowledge. These sessions foster connections between colleagues through a combination of in-person and virtual meetings. Initially, meetings were held face-to-face. However, the COVID-19 pandemic enabled a shift to virtual meetings facilitated by Microsoft Teams. This adaptation has expanded the initiative's reach, enabling connections further. For community hospital-based staff, for public health, for Black Country Integrated Care Boards, the flexibility of virtual meetings has significantly increased the networking opportunities across our organisations. Year-on-year growth in participation, demonstrating the rising interest in this unique platform for cross-departmental networking and the knowledge exchange within the organisations. Next slide. The benefits. Randomised coffee trials, RCTs, offer several advantages. It strengthens relationships by improving communication and encouraging the sharing of knowledge and ideas. It dedicates time for casual conversations that may not cover non-work related topics, yet still contribute to meaningful work discussions. It provides an opportunity to meet with colleagues from different work circles, which is beneficial for broadening one's professional network. It supports the development of internal and external networks and fostering collaboration. Next slide, please. Library team prepare promotional materials such as posters, newsletters, write-ups, email signatures. These are created and shared widely using our trust-wide communication channels and, where possible, email distribution lists. In addition, a presentation slide is incorporated into the Chief Executive's team briefing, with the executive team encouraging colleagues to sign up and participate. Last year, 2023, with our trust under the leadership of an interim Chief Executive from the Royal Wolverhampton NHS Trust, we extended our invitations to colleagues from both organisations to participate. This further enhanced the potential for shared knowledge and growth for teams working across both hospital sites. For the matching process, I arrange a planning meeting with the library team upon receipt of sign-ups. Participants are added to a spreadsheet. The matching process itself, initially participants were randomly matched. We do consider special requests, for example, if colleagues are wanting to meet with another colleague at the Royal Wolverhampton or within the public health team, these requests can be accommodated. Over time, the process has become less random to ensure participants meet new people, as some register their interest now on an annual basis. Meeting arrangements are matched colleagues are advised to meet for 20 to 30 minutes. Meetings can be either face-to-face or virtual and based on participants' preferences. To support, we provide a conversation prompt. This sheet is provided, however, the use of this is optional. Sorry, can we just go back one slide? Yeah, how we did this. So feeding back on November 23, we set ourselves a target of 100 participants, and we were delighted to have reached this. Our promotional activities sparked a wave of enthusiasm across a diverse spectrum of professionals, attracting clinicians, directors, managers, admin and clerical staff, as well as students, all keen to participate and enrich their experience. After their meetups, we encourage colleagues to share their feedback with us via Twitter or X. In addition, we send them email templates, which if they wish to feedback in that way, this is also possible. A full feedback report is created and our learning is shared and captured. Feel free to use the tiny URL to read the report in detail. Here are a few examples of some of our colleagues sharing their feedback, having met face to face. Where this is not possible, virtual meetings have also taken place. I too participated in the initiative and was paired with Rekha from the resuscitation team. Learning about her role and the team's critical services were insightful. Our connection has flourished, leading to collaboration on various trust organised events, including this year's South Asian Heritage Month. During our conversation at RCT, Rekha mentioned about her passion for arts and crafts, specifically recalling a large selfie tuk-tuk she had created for her niece's wedding. When I asked if we could borrow it for our South Asian Heritage Collection display, she was delighted, and the tuk-tuk proved to be a popular addition, gaining us numerous compliments. While many participants have kept me informed about their meetups via email for November 24, we plan to distribute a follow-up questionnaire 2 to 3 months after the event. This survey will inquire whether participants met up and invite them to share their experience, providing us with a clearer picture of how many colleagues engaged in their randomised control trial. Thank you. Next slide. We were proud to share our learning, and a poster was also submitted and selected for display at this year's HLG conference. Next slide. I'm pleased to say preparation is now well underway for November 24. Our promotion material was released last week, and as of today, we have 46 people already signed up and further promotions taking place. And we're hoping to beat our 100 participants of last year. Thank you for your time. I'd be happy to take any questions.
Thank you so much, Bali. I seem to have disappeared from my screen, which is odd, but I can assure you I'm here. That was really, really interesting. And it's so great to hear about the impact that this has had across your trust and enabled loads of interesting conversations as well. So it sounds like it's been an initiative that has had a real on the ground impact. Yes, if people have got any questions, please do post them in the chat. I can see that there are a couple of questions coming in already. So one of them, how often do you conduct randomized control trials every year in your trust? And if people on the call also run them in their trusts, please let us know in the chat as well, because it'd be nice to hear how other people are using them. But Bali, how about your trust?
We run the event annually, although recently we have been asked if it's possible if we can run the event perhaps 2 to 3 times a year, which I think we may struggle with.
How long does it take to kind of do all the matching? Is it quite kind of time intensive?
It's the promotional part. It's getting the material out there, the enthusiasm and the turnaround. So it has to be quite timely. So from people signing up, adding to the list during the first week of November, we send out the pairings. So yeah.
So I think it sounds like people in the chat are really interested in how this could fit into what they're doing in their own service, and just thinking about how do you make the business case for it? How do you kind of outline the tangible benefits and impact? How do you get buy-in from your organisation or your leaders for introducing an initiative like this?
So for because our executive board have been championing the initiative for us as well, so they can see the benefits in terms of connecting people. This kind of stops people working in silos. There's a lot of work that takes place, and there's you're sharing your learning, you're sharing your expertise, and then people are making those connections. So we have colleagues from the quality improvement team, us as library staff, we all participate. And sometimes it's just conversations that you're prepared to have that you wouldn't normally take time out to do that. So having that 15-20 minutes to, yes, we provide like a prompt sheet. It can be work-related conversations, or it can be, we've had people say that they've received a contact for football tickets, and they've maintained that connection. So yeah, as well as work related, it can be social as well. A lot of benefits.
Yeah, and those kind of like social connections also, we know, help to kind of grease the wheels for kind of work engagements as well. And it's so much easier to connect the dots when you kind of know people across the department. So it sounds like it does really fit in to this wider kind of aim of being able to kind of connect people across the organisation and promote more integrated working. So hopefully that sounds like something that if you want to implement this in your own organisation, you could kind of think about like the cultural impact that it has, or the kind of ways of working that it might promote in the organisation. There's a couple of comments about how other organisations that use this. So at NHS England, they use RCTs for new starters. That is managed by the knowledge management team. So that's another way into it. And just thinking about connecting up people who are new to the organisation. So have you found, I mean, you have an example of it in your slides about the tuk-tuk, which is amazing, but are there any other interesting or new projects that have kind of sprung up as a result of RCTs, or the connections that people have made through RCTs?
We're due to carry out a survey in the new year for colleagues that have previously, so if they're participating this year, we want to be able to get more of an understanding of how successful their RCT was. So although we ask people to share their feedback on Twitter or through email, I want to delve a little bit more deeper into the conversations and find out a little bit more as to how successful the events have been for them. Yeah.
Wonderful. And like, on the flip side, are there any kind of things that you've had to troubleshoot when you've been setting up RCTs? Do people sign up and not respond to their partners? Anything like that?
Yeah, I mean, sometimes we have to be mindful that this sometimes can take place over winter pressures. And although the initial agreement was to sign up and meet, we don't tie them into that you have to meet in November. So we have had meetups where it's taken place in December or January even. We encourage this. And if it is that their partner's unable to meet, we do say to them, let us know. If we have another partner who's also been unable to meet, we can always do a rematch. So yeah.
Fantastic. And someone in the chat is interested in how many members of the library team are involved in running the RCT, from like creating the promotional materials, matching people, doing the follow-up and the analysis of all the data that you're collecting.
Okay, so it really is a team effort. There's 4 of us in the team, and we do all pull together. So and we all participate. So we're super keen. We just like to get involved. as well and meet new people. It's our opportunity to be able to do that and kind of showcase, the connections, the networking, and be part of it as well. So, yeah.
Fantastic. And let's squeeze in one more question before we give people a chance to try out RCTs for themselves. So, how long? So you've been running this, is it for a couple of years now?
Since 2019, so
Since
5
2019.
years. Yeah.
And what was the interest like at the beginning? And presumably it's been growing over time as well.
It's grown year on year, but initially, with anything new, you have that little bit of, well, I'm not sure what that's going to involve. How much time will it take, and how comfortable will I be? And now with it being virtual as well, it doesn't. If you don't feel comfortable meeting somebody face to face, there's virtual options there. So we don't put pressure on it. It's a meetup, and you can choose whether you wish to meet with them face to face or virtually. Yeah.
Wonderful. So I can see that there's been a bit of an exodus from people who are ducking out for the RCT bit. But yes, if you'd like to stick around and try out an RCT for yourself, we're devoting the rest of this session to that. So yes, it's time for a randomized coffee trial. So hopefully you've got a drink or a snack of some sort, or your lunch, actually, because it's lunchtime. What we're going to do is we're going to put you into breakout rooms, pair you up with someone else, so you can have a go and experience the benefit for yourself. Bali, you very usefully had some conversation prompts in your slides, so I'm going to put them in the chat so people have access to them. So if you'd like to use these prompts to kick off your conversation, or if you'd like to go completely off piste, please do. But really, the art is in the connections that you are going to create and cultivate today. So hopefully, with the wonder of Zoom, we're going to be whizzed into some breakout rooms now.
Okay, welcome back, everyone. I hope you had a really great connections. You made some good connections with people, perhaps some connections that you never know might lead to other collaboration opportunities in the future. Just wondered, before we kind of moved on to the very last closing slides, how you found it. I don't know if anyone wants to put anything in the chat, or maybe come off mute or what have you, just to kind of see whether you would start it again, whether you would run this in your own trusts or organizations, or how your conversations were.
I'm putting a hand up only because I can't work out where.
Come along, Sophie.
I'm putting my real hand up. And that was really useful. I have never done an RCT before or taken part in one, but there was 3 of us in the end in our room, and we had a really, really good discussion. So about our roles, about things we've done in the past, different sectors we've worked in, but also how we would then take this forward. So I'm really interested in this concept, and I think it would work well for Medway. But actually, I would never have discovered this concept if I hadn't come along to this, and seeing it practically really helps as well. I think actually having a go. So it's good to know that it worked well with 2 of us, but with 3 it was lovely as well, which actually I found quite helpful.
That's really interesting. Adds a slightly different dynamic to things, perhaps. Yeah, thanks for sharing your experience, Sophie. If anyone else wants to share theirs, please feel free to do so. We've had some really positive comments in the chat already about finding some new challenges that people have, but also opportunities. Maybe some shared experiences that people can learn from. People talking about it being a really good experience and definitely something to explore further, and just to have these really kind of nice connections with everyone. We were just chatting as a group about how the different names have these randomized coffee trials, kind of getting to know you sessions. So I think there's various ways you can kind of badge it to connect with your users and to connect across your organizations as well. So it's really positive that you've seemingly enjoyed the session and learned quite a lot. So thanks ever so much for sharing your experiences, and I'm glad you all had a great time. So just before we close up, I just want to pass back to Leslie and Lindsay for just some final closing slides.
Okay, I was just going to thank everybody for coming, obviously, and I'm really glad that, as Paul said, you've enjoyed having a go at this. We've done one ourselves as Health Libraries Group, probably about 2 or 3 years ago now. I think we had about 100 people take part. So they seem to be something that people enjoy and get a lot out of. Really, I just wanted to put a plug in, because I know for Member Fest it wasn't, people might be here from other special interest groups, and some of them are helpfully on the page there. But obviously I'd really like to put a plug in for joining Health Libraries Group. It's a great group, and in terms of making connections and meeting new people, as we've the whole point of randomised coffee trials, it's a really excellent way of doing that. Certainly my time on the committee, I've met loads of people that I would never have met before, and I found it really good way of expanding networks and that kind of thing. So can't really recommend it enough to come along and join us. We're friendly, not too scary, a bit mad, but a good place to be, I think. So please do consider joining us. Thanks, Lindsay.
Yeah, I would second all of that, and just to say, I can see from the people that have joined today that there's a lot of familiar names in the chat already. So thank you for coming along, and I guess HLG and the other special interest groups couldn't exist without people coming along and volunteering. So thank you to all of you who already do, and hopefully we will see some of you at other events or even on the committee in the future. So yeah, thanks to everyone.
Super, thanks ever so much. And just a reminder that Members Week is all this week, so feel free to sign up for some more sessions too. Thank you very much for coming along, and long may those RCTs prosper in your organisations.